Hi everyone, now we will have a class on the anatomy of the facial nerve. Okay, so we all know that the facial nerve is our seventh cranial nerve and it is a mixed cranial nerve. Now, why do we call it a mixed cranial nerve? Because it has the following components: the motor component, it has a sensory component, it has a special sensory component, and also a parasympathetic component. So the facial nerve is derived from the second branchial arch and it innervates all the structures that arise from this arch. Right? Now let us look at the various segments of the facial nerve. We have the intracranial segment, the meatal segment, the labyrinthine segment, the tympanic segment, the mastoid segment, and the extratemporal segment. So the labyrinthine segment is also known as the nervus intermedius or the nerve of Risberg. Okay, intracranial, meatal, labyrinthine, tympanic, mastoid, and extratemporal segments. Okay, now let us look at the branches that arise from various segments. The first segment we're looking at is the branches from the labyrinthine segment. So we have the superior or the greater petrosal nerve and the lesser petrosal nerve, right? So, and then also from the superior and the greater petrosal nerve, we also have along with it the deep petrosal nerve. Together, these two are forming the Vidian nerve. Okay. They supply the lacrimal gland via the pterygopalatine ganglion. And the lesser petrosal nerve supplies the parotid gland. It supplies it via the tympanic plexus and the otic ganglion. Okay. The next one are the branches from the master segment. We have the nerve to stapedius and the cauda tympani nerve. It is the motor supply to the stapedius nerve, the stapedius muscle and the stapes. The cauda tympani nerve via the submandibular ganglion helps in sensing special taste, and along with the lingual nerve, it supplies the anterior one-third of the tongue. Now, the branches from the extratemporal segment are the nerve to stylohyoid, nerve to digastric, and the terminal branches. So, nerve to stylohyoid, it supplies the stylohyoid muscle. Nerve to digastric, it supplies the posterior belly of the digastric muscle. Then, the terminal branches include the temporal, zygomatic, buccal, marginal mandibular, and the cervical. Like this, we used to remember, right? The temporal, the zygomatic, the buccal, marginal mandibular, and the cervical. If you just put your five fingers, you will have the terminal branches of the extratemporal segment of the facial nerve. Now, let us look at the muscles supplied by these terminal branches. The orbicularis oculi, procerus, and the frontalis, along with the corrugator supercilii. All these are supplied by the temporal branch. Now, when we look at the muscle supplied by the zygomatic branch, we have the zygomaticus major, the zygomaticus minor, the nasalis muscle, and the caninus, along with depressor septum. Okay, then the muscles supplied by the buccal branch, these include the buccinator and the orbicularis oris, especially the superior part of the orbicularis oris muscle. Now, the muscles supplied by the marginal mandibular branch include the rhizoreus, the triangularis, the orbicularis oris, the quadratus labii inferioris, that is over here, and also we have the mentalis muscle. Then the muscles supplied by the cervical branch of this nerve include the platysma. Okay, so the platysma is supplied by the cervical branch of the facial nerve. Now let us look at the nuclei of the facial nerve. So these are the lacrimatory nucleus, the superior salivatory nucleus, nucleus tractus solitarius, and a motor nucleus. So the important part over here is the Bell's palsy. This is nothing but flaccid paralysis of the ipsilateral muscles on which side the facial nerve is involved. On that side, there is a flaccid paralysis of the facial muscles. That is muscles of facial expression. So what happens? There are absent wrinkles on the forehead, then drooping of the eyebrow, then inability to close or blink the eye. There is sagging of the corner of the mouth and inability to smile or whistle or blow. All these are occurring due to the paralysis of the facial nerve, resulting due to the involvement of the facial nerve, resulting in ipsilateral paralysis of the face. So any attempt to draw the face Any attempt to make it uniform will draw the face towards the unaffected side, because the muscles on the unaffected side are normal and all of these this side muscles are involved. So this here we have flaccid paralysis, there's no tone, so any attempt to make the face equal will pull the muscles to the other side. Okay, now we have to understand the difference between an upper motor neuron lesion and the lower motor neuron lesion in facial nerve palsy. Now look at this image. In upper motor neuron lesion, contralateral facial palsy is present. See, contralateral facial palsy in upper motor neuron lesion, but only the lower half is involved, right? In lower motor neuron lesion, we have an ipsilateral facial palsy, but both upper and lower halves are involved. Okay, that is the difference between these. Okay. Now, why is the upper half not involved in UMN palsy? Because the upper half has bilateral representation. So it is supplied from both the sides. That is why the upper half is unaffected. But in lower motor neuron lesion, both the upper half and the lower half of the face are involved. Now, another interesting disease is the crocodile tears syndrome. What happens is, after an injury to the facial nerve, when it starts healing, some fibers get redirected to the lacrimal gland. So what happens is, when the person is eating food, the tears start coming out from the eyes because the lacrimal gland gets activated because of this misdirected fibers which go and supply the lacrimal gland. This results in tearing. So we call it crocodile tears because these are fake tears. Actually, the person is not crying, but there is tearing from the eyes.